Reaching the age of 70 is a milestone, a celebration of decades lived with memories, lessons, and wisdom accumulated. But it's also the age when many people find themselves trapped in an endless cycle of medical checkups, tests, and screenings. Suddenly, your calendar fills up with appointments, blood draws, scans, colonoscopies, bone density tests, mammograms, prostate exams, and you may start to wonder, are all these tests truly necessary? Are they keeping me safe or putting me at risk? The truth is startling and often overlooked. Many routine health checkups commonly recommended after age 70 may not just be unnecessary, they could actually be harmful. This isn't about avoiding medical care, but about understanding the changing balance of benefits and risks as our bodies age. Tests that help diagnose and prevent disease in younger adults often become a double-edged sword in seniors, leading to overdiagnosis, overtreatment, and even physical, emotional, and financial harm. At 70 and beyond, your body undergoes profound changes. Your metabolism slows, organs function differently, and your immune system's ability to repair damage diminishes. What once was a minor abnormality can become a complex issue, and paradoxically, many early warnings picked up by screening may never progress or affect your quality of life. This shift means that the approach to medical screening must evolve, but many protocols remain stuck in a younger paradigm. Take the PSA test for prostate cancer, for example. Many men over 70 undergo this test regularly, hoping for early detection and cure. But the reality is complex. Elevated PSA levels can reflect benign conditions such as prostatitis or enlargement rather than cancer. And even when cancer is detected, it is often slow-growing and unlikely to threaten life within the patient's natural lifespan. Yet, a high PSA can set off a cascade: biopsies that cause bleeding and infections, anxiety from ambiguous results, and invasive treatments with side effects including urinary incontinence and sexual dysfunction. For many, the harms outweigh the benefits. Similarly, mammograms in women over 70 have a higher rate of false positives, leading to unnecessary biopsies and treatments. The physical strain of these procedures, plus the psychological burden of worrying about possible cancer, can take a heavy toll on seniors. While mammograms save lives in younger women, the balance in older women becomes less clear-cut. Bone density scans offer another example. Used to assess osteoporosis risk, these scans inform prescriptions for medications like bisphosphonates, intended to strengthen bones and prevent fractures. But these drugs, while helpful in many cases, carry rare but serious risks such as jaw necrosis and atypical fractures. More importantly, bone density alone doesn't always predict fracture risk in seniors, and focusing on medication rather than lifestyle and fall prevention may miss the bigger picture. Advanced imaging, such as full-body CT or MRI scans, often reveals incidental findings, small nodules or lesions that look suspicious but are harmless. The pursuit of these incidental can lead to additional invasive tests, biopsies, surgeries, and anxiety. For an older adult, these interventions carry real risks: infections, bleeding, hospitalization, and even reduced independence. Even routine blood tests measuring cholesterol or blood sugar must be interpreted with caution. Aggressive lowering of cholesterol in seniors may cause muscle pain, fatigue, or cognitive issues. Tight blood sugar control may increase the risk of dangerous hypoglycemic episodes, leading to falls and hospitalizations. At the heart of the problem are two interlinked phenomena: overdiagnosis, the detection of abnormalities that would not cause symptoms or death, and overtreatment, the unnecessary medical interventions that follow. Together, they can sap seniors' physical health, mental well-being, and quality of life. But awareness is power. Understanding these risks allows you to make informed decisions, discuss your priorities with your healthcare provider, and tailor your care to what truly matters, preserving your vitality, independence, and joy. In this video, we will explore the 5 health checkups that seniors over 70 should reconsider or avoid. Armed with this knowledge, you can navigate your health care with confidence, avoid unnecessary harm, and focus on living your golden years to the fullest. Now let's talk about the first checkup that might sound helpful, but could actually be doing more harm than good, especially for seniors over 70. I'm talking about the annual full-body CT scan, often marketed as a preventive tool to detect cancer early. You've probably seen ads or heard well-meaning friends say, "It's better to be safe than sorry." But let me ask you something. Have you ever stopped to wonder if that scan is really necessary for someone your age, or if it's just feeding into fear and draining your health? See, CT scans use ionizing radiation, a type of radiation that, over time, and with repeated exposure, can actually increase your risk of developing the very cancer it's supposed to prevent. That's right. It's like trying to put out a fire by throwing matches on it. And here's the kicker. If you're over 70 and not showing any specific symptoms, the odds that a full-body scan finds something life-threatening early enough to help are shockingly low. But the odds that it finds something insignificant, what doctors call an incidentaloma, are very high. What's an incidentaloma? It's a small, harmless anomaly that shows up on a scan and sets off a cascade of unnecessary tests, biopsies, surgeries, and medications, all of which carry their own risks. Imagine you're a healthy 73-year-old who gets talked into a full-body scan at a local clinic. The scan shows a tiny nodule on your lung, barely the size of a grain of rice. The radiologist flags it. Now you're referred to a pulmonologist. You do a second scan. It still looks tiny, but maybe a bit different. Your doctor says, just to be safe, let's do a biopsy. And suddenly you're in the hospital, under sedation, a needle going into your lung. A few days later, the result comes back. Benign, harmless, never would have grown. But you just went through a terrifying, expensive, and potentially dangerous procedure all for nothing. And if that wasn't enough, let's not forget the emotional toll. Seniors who go through these medical spirals often report increased anxiety, insomnia, depression, and a loss of trust in their own body. You start to see yourself as broken, sick, fragile. Every ache becomes a warning sign. Every appointment feels like walking into a courtroom waiting for a sentence. That psychological burden, especially in your 70s, can be just as damaging as the physical one. Even respected institutions like the U.S. Preventive Services Task Force have warned against routine full-body CT scans in asymptomatic older adults. Their reason? Lack of evidence that it improves outcomes, and growing evidence that it leads to overdiagnosis and overtreatment. In fact, some health systems are quietly pulling back from offering these scans altogether, not because they don't make money from them, but because they know it's not truly helping their older patients. So why does it still happen? Because fear is profitable. Because when you're over 70, you're told that vigilance equals survival. That if you're not scanning, testing, poking and prodding, you're being reckless. But the truth is, real wisdom lies in knowing what to avoid, not just what to pursue. And sometimes, the bravest decision is to do nothing at all. Now, I'm not saying all scans are bad. If you have symptoms, or if your doctor recommends something specific for a known risk, absolutely follow through. But full-body scans, just in case, that's a different story. You deserve more than a one-size-fits-all approach to health. You deserve decisions rooted in evidence, not fear. In empowerment, not marketing. In quality of life, not quantity of procedures. If no one has told you this yet, you have the right to say no. You can ask questions. You can push back. Because Aging isn't about surrendering control to the medical system. It's about reclaiming it. And every time you say, "Wait, do I really need this?" you're choosing strength. You're choosing clarity. You're choosing life on your terms. That, my friend, is more powerful than any scan could ever be. Now let's talk about something that sounds almost sacred in the world of preventive health: the annual colonoscopy. For decades, it's been considered the gold standard for detecting colon cancer early. Doctors recommend it. Insurance companies cover it. And the idea is deeply embedded in our cultural mindset. Better to find something early than too late. But what if I told you that, after a certain age, this test might not only be unnecessary, it might actually be dangerous? That might sound outrageous at first. After all, colon cancer is serious. But here's where nuance matters. For adults over 70, especially those with no family history, no digestive symptoms, and previous clear screenings, the risks of the procedure begin to outweigh the benefits. And yet, most seniors don't hear this. No one sits you down and says, "Hey, this might not be worth it anymore." Instead, you're booked for another scope, like it's just another box to check off. But your body at 75 is not the same as it was at 50, and we need to respect that dot. Let me walk you through what a colonoscopy really involves. First, there's the bowel prep, which requires drinking a powerful laxative solution that flushes your intestines. This can lead to severe dehydration, electrolyte imbalances, and even heart arrhythmias in older adults. Then there's the sedation, which poses its own risks, especially for seniors. Sedation can lead to confusion, dizziness, falls, and in some cases, postoperative delirium that lasts for days or even weeks. And during the procedure itself, there's a very real chance, especially over age 70, of bowel perforation, which can be life-threatening. And here's the part that almost no one talks about. Many of the polyps found in older patients are slow-growing and unlikely to cause harm in your remaining years, especially if you've already had normal colonoscopies in the past. So why do so many seniors still get pushed toward this test like it's mandatory? Why does the system continue to nudge older people into risky procedures with minimal upside? One word: liability. Doctors don't want to be the ones who missed something. Hospitals are incentivized to keep screening. And pharmaceutical companies, yes, even they have a stake in keeping fear alive. It's not always about you. Sometimes it's about covering their own backs, even if that means putting your well-being on the line. Let me tell you a real story. A 78-year-old man, healthy, active, no symptoms, let's call him David, was convinced by his doctor to get one more colonoscopy, just to be safe. During the procedure, they found a tiny polyp. While removing it, the colon was accidentally perforated. He was rushed to surgery. Days in the ICU. Infections. Complications. That one harmless checkup spiraled into a 6-month health crisis. He lost weight, mobility, confidence. He told his daughter, "I walked in feeling fine, and I haven't felt right since." That story is more common than you think. And the tragedy is that it was probably avoidable. For seniors in good health with prior clear screenings, many experts, including those from the American College of Physicians, suggest stopping routine colonoscopies around age 75 or even earlier, depending on overall health. They recommend focusing on quality of life, not chasing ghosts in the form of tiny, slow-growing polyps. But the message isn't getting out there. So what can you do? First, know your history. If you've had multiple clear colonoscopies and no symptoms, ask your doctor whether you really need another one. Second, ask about alternatives. In many cases, non-invasive stool tests are just as effective at detecting cancer markers, and they carry virtually no risk. Third, and most importantly, listen to your body. If something feels off, persistent pain, changes in bowel habits, by all means, get it checked out. But don't let fear drive you into an unnecessary, invasive procedure just because it's on a checklist. You are not a checklist. You are not a statistic. You are a human being with unique risks, a unique body, and a right to make decisions that honor your stage of life, not fight against it. After all, the goal of aging is not to obsess over every cell in your body. It's to live well, with clarity, confidence, and peace. And sometimes that means saying no to a test and yes to your intuition. You've made it this far for a reason. Don't let a system built on over-testing rob you of the freedom and joy you've earned. Let's take a deep breath and look at the bigger picture. Because beyond blood tests, scans, scopes, and screenings lies a deeper, more important question. What truly keeps us alive and well after 70? Is it another test? Another tube? Another fluorescent-lit waiting room with a clipboard in hand? Or is it something else, entirely something no lab can measure? Let me tell you a story. Margaret was 82, sharp mind, strong spirit. Every year, she'd go through a battery of tests, mammograms, bone scans, ultrasounds, blood work, because that's what her doctors told her to do. But every time, the stress would wear her down. She'd lose sleep, worry for weeks over numbers. That never changed. Until one day, she asked the most powerful question. Is any of this still helping me? That question changed everything, because the truth is, after a certain age, the best checkup isn't a machine. It's how you feel when you wake up. Do you move with ease? Do you laugh often? Can you eat without pain, breathe without strain, and think clearly without fog? Those are the real indicators of health, not just test results, not just numbers on a screen. And yet, we're trapped in a culture that tells older adults they must constantly monitor themselves, as if aging is a disease to manage instead of a natural phase to embrace. This culture doesn't tell you the full truth, that many routine checkups after 70 provide little benefit, and in some cases can lead to cascading harm, stress, false positives, dangerous follow-ups, even irreversible injury. But you have the power to change that narrative. Right now, today, you don't need to be in the dark. You don't need to be afraid. What you need is clarity. And that starts by asking better questions, not just what's wrong with me, but what's right with me. What do I actually need right now? It starts by choosing care over control, wisdom over worry, and living over constantly diagnosing. Here's what that looks like in real life. Instead of another invasive scan, you take a walk in the morning sun. Instead of scheduling an anxiety-inducing blood test, you meet a friend for tea. Instead of stressing over a number on a report, you stretch, breathe, and feel your body tell you, I'm still here. I'm still strong. I still want to live fully. That's the kind of health that matters most. That's the kind of check-in we don't do enough. And it doesn't show up on a chart. This isn't to say you should ignore warning signs or avoid medical advice. Quite the opposite. But you must be an active participant, not just a passive recipient of routine. Ask questions, weigh risks, understand the purpose behind each test, and don't be afraid to say, no, thank you. I'm choosing a different path. A path rooted in trust, in presence, in respect for your own body's wisdom. Because after 70, your health is not just physical. It's emotional, mental, spiritual. You've lived long enough to know that life is more than survival. It's about quality, dignity, joy. So if you're watching this, I want you to know something important. You still have time. You still have power. You still have the ability to say no to fear-based medicine and yes to whole body wisdom. Because longevity isn't just about how long you live. It's about how well you live with the time you have. That's why we're here at Senior Health. Today, to give you not just information, but liberation from outdated rules, from unnecessary procedures, from a system that often forgets the soul behind the numbers. Our mission is simple: to help you live smarter, stronger, and more joyfully. No matter what your chart says. If this message resonated with you, if you felt a weight lift or a new question rise in your heart, drop a 1 in the comments. Let us know you're ready to think differently. And if you still have doubts, it's okay. Leave a 0 and tell us what's holding you back. This is a space for real conversation, not just lectures. And please don't keep this knowledge to yourself. Share it with someone you love, a parent, a grandparent, a friend, because the moment we start talking honestly about aging, about risk, about autonomy, we begin to change the future of elder care. One choice at a time. Like this video. Subscribe if you haven't yet. And hit the notification bell so you never miss a message that could change your life or someone else's. Here at Senior Health Today, we'll always tell you the truth even when it's uncomfortable, because your life deserves more than checklists. It deserves wisdom, compassion, and real care. So next time a doctor offers a routine test, don't just nod. Ask yourself, is this helping me live better? Or just keeping me on a conveyor belt of fear? Then decide and choose boldly. You've earned that right.